continue to present the submissions on the Community Health Services Bill 2023 to the Senate Health Committee on the bill, which is at the second stage at the August House, led by Health Principal Secretary Harry Kimutai and County Assembly's Forum Secretary Maurice Ocheng. The committee has urged the ministry to work in tandem by focusing on the current PHC bill so as to ensure the bill is passed into law to ensure community health promoters are recognized constitutionally.
Already in 70.
The series of stakeholder meetings in the healthcare sector continued today, with more interested parties submitting their views before the Senate Health Committee to opine their mind on the Primary Healthcare Bill 2023, and together have resolved to endorse the bill, which is set to benefit the community health promoters in a bid to boost the healthcare sector in the country.
There are very many pieces of different legislation from different corners. We also, I think, have the community health workers bill, which also speaks to these issues. Now we also have this community health services bill. Now we're introducing a new baby altogether that will allow you to blow your trumpet again.
While appearing before the committee, propositions by Principal Secretary Minister of Health Harry Kimutai and Secretary of the County Assembly's Forum Maurice Ocheng agreed that the approval will lead to changes in the healthcare sector.
The Ministry of Health has drafted a primary healthcare bill, which include the community health services articulated in this bill, and the primary healthcare bill has been forwarded to the National Assembly Department Committee of Health for their concurrence and introduction as a bill in the National Assembly so that it becomes a committee bill.
You are the oversighters of the devolved functions, and that is why I was telling the PS should take the committee very seriously. When it comes to devolved functions, they should not play the devolved functions. I know the president is up to the task to make sure that devolution works.
However, Secretary Kimutai is moved to demand the draft of the Ministry of Health to be used instead of the existing one hit a rock after the committee requested the ministry to use the existing bill.
I think legal person can assist us if our standing order and the standing order of National Assembly can allow both houses to sponsor the bill of PHC. I don't know, you can guide us later, but let's hear from our chair, able chair.
Before you hear from the chair, I just wanted to have concurrence. Who can sponsor this bill for us? Is it National Assembly Committee or the Senate Committee?
According to Kimutai, the bill will identify a community as 1,000 households to be appointed by the county government and is poised to help a lot in the success of UHC system and healthcare decentralization.
For the purpose of trying to assign work to, households to a community health promoter so that it becomes very clear and not something that they're handling the entire community.
The committee is set to organize a session with the Ministry of Health during the devolution conference to bring all the hanging ideas together so as to rally and include relevant points in the Primary Healthcare 2023 bill.
A workshop or a retreat so that we agree who is going to take up this. So it's not something that has been finalized.
That retreat is joint?
We wanted it to be joint. Okay. It's proposed that way so that it's agreed who is going to take the leadership of this bill. If it is the Senate Committee, we'll hand it over to Senate Committee.
Allow me to make
another day before the Senate Health Committee, led by Principal Secretary Health Harry Kimutai, stakeholders are now being urged to support the current primary healthcare bill before the Senate and put aside any other so that to ensure all community health promoters are enlisted and recognized to achieve UHC. Stanley Lugaria, Look Up TV, Nairobi.
The Senate